Hello, I'm Dr. John Luther. I'm a retired family doctor. I dislocated my shoulders twice about 30 years ago, and I also dislocated my collarbone about the same time. So we're going to have a look at that. Let's bring in the shoulder model. There we go. Let's zoom in on the shoulder. And we'll also come up a little bit, so we can have a look at it. Here's the arm bone, upper arm bone, called the humerus. Here we see a sort of a semicircle or a ball, half a ball shape, covered with cartilage. Here's a small cup. Cup is very small and doesn't really do much except hold the shoulder basically. The shoulder is held together with tendons and ligaments. The tendons are called the rotator cuff. The capsule of fibers going across here is called the joint capsule. We can also look here to see the collarbone. There's a collarbone attached to the shoulder blade. There's a chromium part of the shoulder blade, and there's a junction there. Here we see the cup is very shallow, but it's helped a little bit by cartilage that goes all the way around. Let's talk about some things that can dislocate. The shoulder can dislocate. It can dislocate anteriorly. So it dislocate coming forward, anterior, going backwards, posterior, going down, inferior, or coming down this way, another type of inferior because the head is pointed down. Let's talk about the treatment for dislocated collarbone. Collarbone here attaches to the shoulder blade. So if you hit the ground in football, or someone tackles you in football, your body stops, but the collarbone keeps moving. So the collarbone here keeps moving and can produce quite a lump. So you have to decide whether you want to get rid of that lump. If you're 70, 80 years old, you might be able to live with it and not do anything. If you're younger, you might want to get a screw put in. Here's a screw put in by an orthopedic surgeon, and that has to be left a couple weeks and taken out later. You can't leave it in, it will fracture and then cause even more pain. So let's talk about ways to treat dislocations. First of all, let's talk about different terms. Try to put things into English instead of Latin. A dislocation means a joint that's out of place where it shouldn't be. So if the shoulder pops down or backwards, that's a dislocation. Subluxation means the shoulder dislocates just a little bit like that and then pops back in. Separation means when the collarbone separates from the shoulder blade. It could be because of a dislocation, but a lot of people prefer to call it a separation. Getting rid of the dislocation is called a reduction. So if it's anterior here, traction there, and trying to get it back in. So reduction, traction, dislocation, subluxation, separation, reduction, and traction. Let's talk about treatment. If the shoulder comes forward, one way is just to put traction, pulling and pulling and pulling, and then trying to get back in. Another way to go at it is to gradually rotate it this way and then bring it up that way over and trying to get it to pop in. Posterior dislocation back here, I'm not sure how to treat it, but it does involve traction. Inferior dislocations happen in old people when their muscles get weak, and that can happen without an injury. And treatment is to try and tighten up the muscles around the shoulder. I don't know how to do that, but you might want to talk to a physiotherapist. This type of inferior dislocation, you want a lot of traction. Got to x-ray all these. If you don't x-ray them, if you've got a fracture through there and you're pulling on it, it's a lot of trouble. There's a lot of nerves coming through here in a big artery. So if that goes down, hits the nerves, your hand can go numb, or your arm can go numb. So if your family doctor can't get that in a small town, you're going to have to consider going as quick as possible to a major center, see an orthopedic surgeon. The main thing, if you're playing hockey, you think your shoulder's dislocated, very painful, won't move, just remember you're going to have an empty stomach. So don't eat or drink. And the general anesthetic they might give you for 10-15 minutes will probably do the trick to get it back in place. These muscles get very angry when the shoulder dislocates, and the muscles are actually preventing it from pulling back in. But the general anesthetic will tend to relax that. So we've got anterior dislocation, posterior dislocation, inferior dislocation, and we'll talk about some sports maybe to avoid. These are the ones I would avoid. Golf. I tried golfing after I dislocated my shoulder, but it got painful, so I didn't do that. Tennis. Kayaking and canoeing I do on very calm water. But if your shoulder starts to get sore, you're going to have to stop. The big thing is, here's the anterior dislocation, most common. If that starts to go up and down and clicking all the time and getting sore, it's going to wear the cartilage right off the top of your humerus there. So, kayaking and canoeing, very calm water. While swimming, front crawl and butterfly, maybe a little bit too much for you. Windsurfing you can try, but once again, don't go out in the middle of the lake in case you dislocate your shoulder in the middle of the lake and no one can help you. Similar to kayaking, canoeing, don't go up north in rapids. Might take a long time to get you back to hospital if it dislocates, and you're going to have a lot of pain for a long time. Walking poles are good. If you get your walking poles and you're just flexing at the wrist, tends to help. Keep all of these. Keep your elbow close to the body. If you're using paddleboard, I find the paddleboard is good because my elbow is close to my body. If I'm swimming in a lake, I'll swim on my back, sculling my hand back and forth. Keep the elbow close to the body and the shoulder's not moving too much. Sometimes I want to do breaststroke. Instead of doing breaststroke and treading water, which is a lot of effort, I tend to put a snorkel on and then just do breaststroke very gently. Try not to stress the shoulder. So these are some of the things you do. Some of the surgery you can have is this is a subscapularis muscle here. This is called a scapular shoulder blade. There's muscle here attaches to the humerus, or the top of the arm bone. To tighten that up, they can move this over a little bit and then staple it or sew it in. There's other things you can do as well. The joint capsule is fibers here that run across. If you do an MRI scan or CT scan, MRI is the best. Find tears in the capsule, then go in and tighten that up. They can pinch it together here, or sew it, or staple it back together. Well, this is Dr. John Luther on dislocated shoulder, dislocated collarbone, called a separation. Over and out.